Welcome to Zoom into a Career, a series designed to introduce students to a culture of high achievement and highlight the many different career pathways available to them. I am Mrs. Hopkins, a business teacher at Yelm Community Schools, and today we have Molly Tamayo with us to share a little bit about her career with VCA Animal Hospital. Before we get started, I'd like to remind you that this Zoom is being recorded, and a link to the video will be posted on our website for future viewing. Welcome, Molly. Thank you for joining us today.
Hi, thank you.
Okay, so can you tell us a little bit about your company and what role you have with them?
I work for the corporate of VCA Animal Hospitals across America, and my current role is I'm the internal medicine veterinary technician, so in specialty medicine.
Okay, so what do you do? What does that mean?
So I work with a board certified internist in veterinary medicine, and we see patients that have been referred to us from general practices. So if you take your dog or cat into your regular doctor for vaccines, spays, neuters, things like that, but if your pet gets sick and your doctor is to the max of what they can provide for you, they will refer you to an internist who specializes in the internal medicine area, so anything internally, and we provide advanced imaging and diagnostics.
Very interesting, thank you. How did you get into your career field?
I was back in high school, and actually my mom actually came home from a vet clinic once and said, hey, they're hiring for kennel help. Why don't you go see what that is? And so I did, and sort of just fell into it and enjoyed the whole time. At one point, I thought I wanted to be a doctor, a vet, but I decided that was not an avenue I wanted to go. So I decided to stay with the technician role, and I haven't regretted it.
So what is something that people don't usually know about your job, or something that you've had to learn on your own or teach yourself?
Have to communicate with people. You can have general conversations, but when it comes down to very complicated and emotional conversations with clients, no one can teach you that. It's sort of learn as you go. You make mistakes, and to be able to teach others about medicine that you do can be complicated as well.
So not only like knowing how to work with the animals, your patients, but how to talk to their owners, obviously, because you'd have to get the information from your people, the people skills.
Yeah, a lot of people get into the field because they don't want to deal with people. And once you're in the field, you probably deal more with communicating with people than you actually do handling the animals. And most of the time, learning your job as far as dealing with the animals is a lot easier than when it comes to communicating with people.
Interesting. What is a recent problem you had to solve, or a project that you worked on?
I honestly, a problem or a project recently, I kept thinking about that, and in the role where I'm at right now, there's not a lot of problems or projects that we're currently working on. If you go with cases, sick animals, those can be problems. But really anything specific beyond that, I don't have any.
All right. What are important skills and training you needed to enter into this career field, or what certificates do you have to have, or what schooling do you need to do, or what advice would you give the teenagers?
So it depends on state to state of if you're wanting to get into veterinary medicine and you want to be a veterinary technician. Depends on the state that you live in. Some states require, and it is mandatory, you have to have a state license to practice as a veterinary technician. In the state of Nebraska, you have to go to an accredited school and then pass what's called the VTNE, which is the Veterinary Technician National Exam. That exam then will officially make you a licensed veterinary technician. Some states don't require that. Some states will do training on the job. So the schooling does require at this time a 2-year associate's degree, and then completion of the national board exam. By that, then you're a veterinary technician. You can go beyond that and get your bachelor's degree in veterinary science, or now you can specialize in medicine, critical care, cardiology, but that's really more predominant on the coast. Midwest is a little bit behind. So accreditation is you have to take your continuing education yearly. So you have to have 16 credit hours to keep your license. And then it's endless opportunities in veterinary medicine. There's a lot of careers that people aren't even aware of that requires or a veterinary technician is actually doing. There, you can go to the USDA, you can work in laboratories, you can actually work for pet insurance companies. They actually want veterinary technicians in pet insurance because they know the medicine. You can get into general practice, you can do large animal, zoo animal, exotics. You can do quite a bit with that and then build upon that. But you have to, like I said, it just depends on what state. So if you know you're never going to move and your state where you live in does not require a license to practice as a veterinary technician, that's completely your decision.
So what do you think, like a high school student, maybe a freshman, what kind of things could they do now to maybe prepare if they love animals, they just want to get into this career? What's something that they could do?
They really need to work in a clinic setting. So, you know, you can work with a general practice, you can work emergency, you can work, if you know you want exotics, it depends on what you know you want to do. You really need to start working in that area to really see what the world is about. A lot of people say I want to go work in medicine because I love puppies and kittens, and that's not always the case. There's some pretty sad experiences that happen. If you have to deal with, the hardest part is euthanasias, when euthanasia is expected and when euthanasias are not expected, and that's based on money and when people cannot afford their pets, they have to euthanize or they relinquish their pets. So there's a lot of things that go on within. So I highly, highly suggest if you are considering going into veterinary medicine, you need to work in the field. And a lot of clinics will hire young kids to do kennel work. So that could be cleaning, walking the dogs, things like that. And then you can kind of start to see what goes on in there. But that would be my recommendation.
Thank you. What advice would you have given yourself in high school to better prepare yourself for your career field?
For this career field, I worked in a veterinary clinic my entire high school career, so I got that underway. I wish I would have been more diligent with my studies, such as science and math, to help understand some of the higher quality medicine, and potentially a little bit more focused on those areas that I had interest in and started just kind of pushing it away.
Thank you. What else would you like to add? What else should we know?
Veterinary, I would say in veterinary medicine and human medicine the gap is becoming closer together. That veterinary medicine is not far behind in the ability to provide the excellent care. We're doing telemedicine now. They have advanced imaging, CT and MRI. Clients will pay a lot of money for their pets. And now that pet insurance is becoming more popular, and that some insurance companies will now pay direct, so you don't have to pay that money up front. They will work directly with vet clinics where you supply the pet insurance, you don't have to pay anything. So the human and the veterinary medicine world are becoming closer together to provide that care. So it's a pretty amazing opportunity to get into because it gets bigger the longer you're in it. You don't realize how big veterinary medicine truly is. And it's the one with the recession, with this COVID-19, that the majority of clinics have stayed open. They've been busier. And through that recession, I will say that, especially, I could say here in the Midwest, we never saw a hit. People are still spending the money on their pets.
Sorry about that distraction. Speaking of, it was my cat playing with a toy on the wall. Silly cat. Anyway, thank you. Thank you for all that. I think that the students will be really interested to hear all of this. Some things they hadn't maybe thought about before, some things that maybe they can prepare themselves more as they start looking for volunteer work, probably.
Yeah.
What about like the Humane Society? Is that someplace they could maybe volunteer?
Yeah, humane societies are always looking for volunteers to play with cats, to walk the dogs, just to do about anything to deal with the geriatrics. Each humane society, they have kind of categorizes their patients, their patients, I'll call them, differently. So they're always looking for volunteers, and even rescue groups. But if they're interested, they should try to shadow a veterinarian or shadow a technician and just expose yourself as much as you can, so you really see the whole picture.
Should we take a walk around?
Sure. I think there's a couple emergencies here, so I have to wear a mask. Hold on a second. All right, so our lobby. Can you see it okay?
Yep.
And I may not say anything. I might just turn the phone around. Ooh. We just have a lot of construction. This will soon be a radiology room. One, we will have two. Well, that's an office. That's not going to be an office, but it is an office now. This is under construction. It will be quite large when we're done. I'm going to walk back down and I'll show you where ICU and our surgery is at. We have doctor's offices, big office. That's going to be a bathroom. And where I'm going is our CT area. This is the control room out here. And CT. Is that good? Can you get that pretty good?
Yeah, it's coming in really clear.
Okay.
I think what's really cool when you show me around your vet clinic, that not having spent a lot of time in the animal world, but it's just kind of like people world. So pretty much everything you would do for people, you can do for animals. Like you had your pharmacy, you have your radiology, you have your CT scans, you have, like your nice lobby. Really, that's for the most part, that's all we see. But
yeah, and like I said, the veterinary world and human medicine, or the gap is closing, where some states now have mandatory controlled substance logs as if they do in humans. Veterinary medicine has the same laws and logs, and you have to be accountable. And we record everything. You have to have a script, so it's not just my dog is sick, I want to get an antibiotic. You actually have to do the appointments. That has changed in the last 15 years. All right, so we're gonna go into ICU. Well, that's pretty sad. Nose against the cage.
no.
Yeah, it's my bestie. Yeah.
So these are all patients waiting or have had surgeries that,
Or being hospitalized because they're sick.
oh,
And then computer systems. Everyone wearing their masks. Nobody knows who's who. We don't know what we're saying. We could be cussing at you and you don't even know. Here's our second radiology room. So everything is digital. So x-rays are digital now, just like they are in people essentially. So I'll bring it up. So just a chest and a dog.
very cool.
Yeah.
Everything is computers. That's what we teach the children in tech comm. Everything is on computers. You have to know your computers.
Yeah. So now we're going into our surgery area. This is our induction. As you can see here, just like in a human hospital, you have to have your appropriate attire on. And then this is where all the reprocessing goes with the surgical instruments.
Interesting.
And then sterile corridor, just like they do in people. So you have to have your cap mask, booties, everything on to go into the corridor. So I can't tell, but it's a long hallway. So you have 1, 2, 3, 4 OR suites. So, and then we'll walk. So now we're walking back towards our laundry room area. So food, where all the food is kept. Can't let clients inside. So we are one of the only clinics in Omaha that have allowed clients to come into a part of our hospital for humane euthanasias to be with their pets. So that's the hardest thing, and how non-friendly the room is. As you can see, there's a big stop and there's just 2 chairs. So that is our humane euthanasia room, this is the saddest part of the whole thing.
Oh.
So then this is our laundry room. There's right now during our construction, this is where ultrasound is, and then our washers and our dryers down there. Bathtub. And then this is our central storage where all of our supplies are kept. So we're still under construction. So a lot of it is obviously kind of messy, but that's the hospital.
Wow, thank you. If there were like service projects that students would want to do for a veterinary clinic or the Humane Society or something, what would be something that they could, what would be a good service project? What is something that they could do to help out?
Well, I suppose that most veterinary clinics are always in short in towels, blankets, beds, things for the pets when they're sick. They're in short demand. Projects to help clinics out. I would suppose some general practices will do volunteer work too. They can come volunteer and walk the dogs. But each state's a little different of what the regulations are. I would say have them start with the Humane Society. They're going to get the best out of that with the Humane Society and where they can volunteer.
All right, thank you.
And also with rescue, I think rescue groups want volunteers too, to even take their pets for walks, or they can foster if they want to attempt that. Fostering is always an opportunity where you can have the pets, but you don't own them, so you can not feel a financial burden as well.
Thank you. Thank you so much for showing us around and talking with us today about life in the vet clinic.
Sure.
People will find that very interesting. Yeah, so as we're wrapping up today, what's one last thing you would like to tell the students to remember? Something, what's their takeaway?
Their takeaway is don't limit your opportunities of what you want to do. You need to explore everything. So you have an idea, I would explore it. Shadow, go into the areas that you have an interest in. That's the only way you're going to figure out if you like to do it or not. to go and get a degree and find out you don't like to do it, that would be pretty rough. So you need to just to go out and work in the area that you think you want to do to figure out if you want to do it. That's simple, but a lot of kids don't do it.
That's really good advice. We tell them that all the time in school too.
Yeah.
So this is great. Thank you. Thank you for sharing with us, and we very much appreciate you taking the time for our students.
You're welcome.